The following is a pre-recorded show. Welcome to Winning in Retirement with your host, Brian Akers, certified financial planner professional and founder of Akers Financial Group. Now, helping you win in your retirement, here's Brian Akers.
Good morning. I'm Brian Akers, and here with me today is Jeff Akers. We're both certified financial planner practitioners from Akers Financial Group, and we welcome you to Winning in Retirement. We've both been in the industry for a number of years. Jeff has over 20 years working with us. Good morning, Jeff. How are you doing today?
I'm doing great, Brian. And I might have 20 years, but you've got 30 plus years.
But that does not mean I'm 10 years older. It just means that I pulled Jeff out of another industry at 20 some years ago to have him join our financial group and then build his practice from there. So, today we had to set up a show today that's going to be fun, a little depressing, but the idea is this. There's a necessity in retirement where you need to know the following to make sure you have things worked out. We've talked about on our shows about retirement income, Social Security, how to draw the money, how to bring in that cash flow. But what happens is that the most important thing that we think is you got to know your number, and your number is what money do you need? And the two biggest expenses in that need is what we're covering on our show today. What are those two biggest expenses, Jeff?
I find it a little ironic that the two biggest expenses are usually the ones that are overlooked the most. One is healthcare, and the second is taxes.
Yep, so we named the show Two Biggest Expenses in Retirement, Healthcare and Taxes. So those are still in bed listening to the show. This should be a good one for that, to stay in bed. Those driving, don't get depressed by the show. Understand that it's just part of it. We need health care in our retirement years, and yes, we do pay taxes in our retirement years. But there are certain topics, certain concepts you need to know at your earlier age so that you can be prepared. The sooner you start, the better. All right, Jeff, so cash flow to us is extremely important.
Right.
And knowing expenses is important. Why is it so important in planning?
So in retirement, your income is generally fixed income. And so you really need to know where those dollars are going. And, how much goes to healthcare, how much goes to taxes, and how much can you control of those expenses. So you've got money for other things that you really like maybe eating and stuff like that. You want to have money for all that stuff.
Maybe eating?
Yeah, maybe.
And you like eating, I heard.
Yeah, I do.
All right. So if you did a budget and you did like a circle, you would say that most of that circle, at least half of that circle, would be taxes and insurance and healthcare and taxes. And then the rest of it is what you want to live off of, and you want to enjoy the retirement years. Enjoy the retirement years is eating, but it's also entertainment. It's getting out, doing things. It's traveling. All costs money, and it's things that we have to have in that budget to be able to retire and have the money flow in to cover the expenses on the flow out, to make sure you can go on that long-awaited trip and stay on the trip without running out of money, right?
Oh, yeah, because we love seeing the pictures when you get back from that trip.
Yeah, it is really nice. Now, one of the things we've been telling everyone is pay your mortgage off by retirement, because we have an expense that's going to replace your mortgage. What is that, Jeff?
That's going to be healthcare. There have been some studies that say that if you're 65 and you live to normal retirement age, that you're going to spend around, actually it's closing in on $400,000 now to do that. If you live beyond that to 95, then you might spend $500,000 or $600,000 on healthcare, premiums, co-pays, all that stuff. So that's a pretty nice house, $600,000 or even $400,000 for the lower number. So you want to have that money available to pay that expense over your retirement.
All right. So you had to say a huge number, but my brain works in like a monthly bill. When you talk about healthcare on a monthly bill basis, like, what kind of range are you talking about for people that retire?
Well, for an individual, probably around $1,000 a month right now on Medicare, because you got your Medicare Part B and Part D and supplements and all that stuff. And then you got co-pays in addition that can actually make the number go up, and deductibles depending on what kind of coverage that you actually have. So,
are you saying $1,000 a person for healthcare and retirement?
It can be $1,000 per person per month.
And you're counting what components? Go through those slowly.
Okay.
So you're talking about people in retirement. What are the components of the healthcare expense you're talking about?
So in retirement, after age 65, you're going to have Medicare Part B. Right now, the premium for Part B is $170.10 a month.
That's 11% higher than last year.
13.5%. It was a huge increase. Then there's the Medicare Part D, which I can't give you a firm number on that because you buy that from an individual company. But Part D could be anywhere from $20 or $30 a month, even up to $100 a month if you got a really expensive plan. Then you have to get a Medicare supplement, and the supplement is what fills in the gaps. You might have heard of Medigap policies. And so the supplements fill in the gaps of Part A, Part B, so that you've got your total coverage package there. And the supplement, that by itself could be $300, $400, $500 a month, depending on your age and what plan you take. So when you put all that together, you're closing in on $700, $800 a month in premiums. And then after that, you go to the doctor, you're going to have copays and things like that. And so it can get up to $1,000 pretty quickly. And the Medicare supplement, the older you are, the higher that premium is. So,
and we have a lot more information about post-65 we're going to cover in the second quarter.
Right.
What I wanted to cover right here is, think about that number. And Jeff was saying $1,000 a month. And it's like, well, where does that come from? What is that going to be? And the idea is this. We're talking premium through Medicare, premium for coverage that fills in around Medicare, and then the actual expense of healthcare, adding it all together gets that $1,000 number that he was explaining. Now, we'll explain a lot of other scenarios in the second quarter about that. Now, about budgeting for somebody getting ready to retire pre-65, what are the expenses like for healthcare?
So pre-65, your first option is COBRA. If you leave your job, you can...
So you buy a snake.
COBRA, it's a term for being able to keep your health insurance from your previous employer, but you pay the full premium.
Everything.
Yeah, everything. When you're working and you've got health insurance, your employer is paying part of your premium for you most of the time. It's
amazing when someone who's been with a large company or a government position their whole career, most government position has retirement health, but more private, and they've been paying like half of it or more, and they think, oh man, I've been paying $300 a month, $400 a month. That's incredibly expensive. And then we look at COBRA. What kind of numbers are they?
Well, a COBRA number that I looked at recently was $1,000 a person.
Yeah.
So it's
just for the healthcare premium.
Just for the premium.
Not copays, healthcare. Not expenses, nothing else.
And keep in mind, that's not including dental or vision either. Some people want to have those coverage. We're just talking healthcare and prescriptions. So COBRA is option number one, but COBRA only lasts a certain amount of time, 18 months. So
18 months. Can it extend at all?
It can extend for dependents of someone who retires up to 3 years to get them to kind of bridge that gap to Medicare at age 65. But if you think about if you're 63 and a half, you've got a year and a half to get to Medicare. So at that point, you could take COBRA, and that would get you all the way to 65, and you never have to do anything else, and you just go on Medicare at that point. Option two, though, is you go out and you get an individual health insurance plan. And you could get a plan directly from a company, or you could go through what we call the Obamacare sites. In Maryland, it's called the Maryland Health Connection. You put in your information, and you can get a health plan that way.
ACA?
ACA is the Affordable Care Act. That's the official name that's used for Obamacare.
All right. So the ACA, you go in there and you can actually check and shop premiums. And the key ingredient there is that there is no pre-existing conditions takeaway. There's nothing that they're not going to cover.
Right. Pre-existing conditions have been eliminated. They don't apply to ACA-approved plans.
And then also through the ACA, you could qualify for some subsidies depending on what income you're making in the pre-retirement years, depending on how you draw your money.
That's right. So you put in your information, you put in your estimated income for the year, and they'll tell you if you qualify for a subsidy or not. But keep in mind, whatever you put in, that's what they're using to calculate it. Then you get to the end of the year, and maybe you earned more than what you thought you would, or you had more income than you thought you would. They're going to take back some of that subsidy in your tax return the next year. So
I have a weird question for ACA. So you're applying and you have one spouse who needs the coverage, another spouse that doesn't need it. Do they count all the income in ACA or just the spouse that needs it?
It's household income.
It is household income.
Yeah, it counts the entire household.
Okay, so the number you're looking at is household income.
Right, but the way they figure that subsidy that they could give you is also based on the number in the household. So it's basically how much income do you have for how many people.
Okay. I think I understand.
It's a government kind of program, so that means it's going to be confusing from the start.
I don't feel like you love the plan. I know that things have changed over the last decade or so, and at Akers Financial Group, we bring Jeff in and all of our retirement plans for him to have this kind of healthcare talk with someone about what's going on with all their choices, making sure they know what's going to happen so we can plan the portion in the budget it's going to be. Now, when we say $1,000 a month for just the premium in the pre-65 retirement, that's a number that you need to look at. This is assuming zero subsidy, zero retirement health care. Many times, if you're a state employee, government employee, and you do your 30 years, you're going to get coverage right away, no matter what age, right, Jeff?
Right. So if you're a state employee or any kind of employee that has a pension, there may be an opportunity to get retiree benefits when you retire. At age 65, that's usually called normal retirement age, so you would have benefits for then. But if you retire pre-65, you may have some retiree benefits that you can use for health insurance that get you up to age 65. While we were talking, though, I just took a quick look. The cheapest premium for a 60-year-old that I found right now is a little over $500 a month, and that's for a plan with a deductible of about $8,200 over the course of the year. So it's you can pay less in premium, but you're going to pay more to get your services if you do that.
Right. So this has to be part of the budget when you talk about retirement. This is why people do work to 65 instead of retiring early. Make sure you know all these things. Now, at Akers Financial Group, we're local, we're independent. We don't report to a big company on Wall Street. We report directly to you. We do have offices in Forest Hill and Lutherville, Maryland, but we have clients all around the country. Retirement is all about you and not about us. It's so easy to begin winning in retirement. You can simply do one of two things. You can go to our website at Akers Financial Group and scroll down to schedule a meeting and just enter your information there, or you can give us a call. You can call us at 833-WIN-RETIRE. That's 833-WIN-RETIRE. Either way, we'll reach out to you on Monday to schedule your free in-person meeting, a Zoom meeting, or phone meeting. Go to AkersFinancialGroup.com or call us at 833-946-7384 to start planning for your retirement now. Where will your health insurance come from in retirement? You might be surprised. We'll explain in the second quarter.
You're listening to a pre-recorded show. Welcome back to Winning in Retirement. Call 833-WIN-RETIRE now to schedule a visit with Brian and his team and begin winning in retirement. Once again, here's Brian Akers.
I'm Brian Akers. Here with me today is Jeff Akers. We are certified financial planner practitioners from Akers Financial Group right here in Maryland, but we work with people all around the country. Today's show is called Two Biggest Expenses in Retirement. Yes, you're thinking, I'm young, I don't need to listen to this part. What we want to do is cover what the future looks like, and we want you to hear the numbers so that when you're saving and investing, you know you need a lot of money saved for retirement to cover all these aspects. So in the first quarter, what we talked about was retirement pre-65. We got a little detail on the healthcare there. Touched a little bit about post-65, but we are coming into the second quarter with this first question, Jeff, and that is this. Where will your health insurance come from in retirement? You might be surprised. So what do we want to talk about here, Jeff?
All right. So the first place for most people that healthcare is going to come from after 65 is Medicare. Most of the time, that's going to be the source of retirement healthcare. So you're going to have Medicare, which I'll go into it a little bit later in detail. I think we'll go through some questions. Some folks have pensions, and they have healthcare included with that, and so they'll get part of their healthcare from that. Some people don't, and so they'll end up buying a supplement. They'll get maybe a Part D kind of prescription plan. But for the most part, it's going to be Medicare, and kind of the Medicare universe is going to be where you get your health care.
All right, so Medicare is the premium you can pay quarterly if you're not drawing Social Security, or it comes out of your Social Security.
So that's Medicare Part B. Part B is for outpatient kind of stuff.
B is for boy?
B is for boy. B is for a lot of things. B is for Brian. But B is for the healthcare that you get in the doctor's office. That's outpatient kind of thing. There is a Part A. Yeah. Part A is for hospitalization. For most people, Part A is free, so you don't pay for that.
Why do you say most people?
Well, there are some folks, certain circumstances where you might have a premium for Part A. If you haven't paid into Medicare over the years and you take it, then there might be a premium for that.
Oh, wow.
Yeah, that does exist.
All right. So our goal is to bring up the concepts and all the reality of trying to cover healthcare and understand that it's just not as easy as, oh, I'm covered. You need to know, are you covered and how are you covered?
And can you afford your coverage?
All right. So right now we're talking about post-65 retirees. So people hit 65 and they have to apply for Medicare. When do they normally do that?
So you apply for Medicare about 3 months before your 65th birthday.
Where do they go apply for Medicare?
SSA.gov.
SSA, that's a Samsam Apple?
Samsam Apple or Social Security Administration. The application process for Medicare goes through Social Security.
Each individual person must apply at 65?
So you have to apply at 65. If you don't, there could be a penalty down the road if you decide to sign up when you're 70 and you haven't taken it when you were 65. However, if you or your spouse is working and you have employer-sponsored health insurance, you don't have to sign up for Medicare at 65. You can wait until after you've both retired and you're not on that employer-sponsored plan anymore, and then you can apply. You have a special enrollment period at that point.
But you have to prove it.
Yes, you have to prove that you had coverage, so you'd get a letter from the employer or the employer's health insurance plan, and you'll have to send that to Medicare to prove that you had that coverage.
All right, so if you're turning 65 this year, understand about 9 months in, 64, 9 months, go to that website and check out and sign up for Medicare.
If you're already taking Social Security before 65, they will automatically sign you up for Part A, and they'll send you a letter saying you're going to be automatically signed up for Part B unless you tell them not to.
All right, this is another thing on that list of what to do at certain ages in life, and that's one of them, right?
That's right. You get your driver's license at 16, and you sign up for Medicare at 65.
Yeah, so many other age groups, but we don't have time for that on the show. We're hitting things fast today. The two biggest expenses, healthcare and taxes. So far, we're covering healthcare. In this section of healthcare, we got some more bad news to cover, and that is this. Many times, your last year of retirement is a good year financially. You get cashed out of sick leave, you get cashed out of maybe bonus, stock bonus. You might cash out on deferred comp, and your income goes up. And one of the things you need to understand is that Medicare is means tested. What does that mean, Jeff?
It means that if you have the means to pay it, they're going to make you pay it, all of it, and then some. So for this year, the normal Medicare premium for Part B is $170.10. The highest premium you might pay if your income was really high in 2020 is $578.30 per month for Part B. Now, Part D, the prescription part, is also means tested. And so whatever your premium is for whatever you buy from the insurance company, there's an increase on top of that that can make that a lot more expensive as well.
All right. So what was that high number for 2022?
$578.30.
All right. So let's say you look at Social Security and you see that your Medicare is not 170. And you're like, well, what happened here? Why am I paying so much? And the answer is you made a high amount of income in what year? The year before or 2 years before?
2 years before. They're looking back at the first year that Medicare knows how much you made.
All right. So let's use an example of 2022 retiree. They are 65, starting Medicare. They're going to look at your 2020 taxes.
That's right.
And not 2021.
Right.
But let's say it's just a 1 year high year. How do you deal with the Social Security on that?
Well, one thing you can do is you can file an appeal and show them what your 2021 income is. Conceivably, right now, you could do your 2021 taxes really quickly, and that way they've got 2021 to use to gauge your income. But for the most part, you just have to be aware that year, this year, 2022, is going to be a high expense year because of this Medicare cost, and you have to plan for that. And it can be tough because, like Brian said, 2020 is the year you retired and you had a lot of income and things were great. and now you're kind of on your fixed income budget, and now your expenses go up through the roof. So you got to be prepared for it.
Let's talk about that chart a little bit and where planning fits in. So a married filing jointly, when do they pay extra premium? What's the first level? Is it like 170 some thousand?
It's 182,000.
182,000 for this year. So that means if you show 182,000 or higher, your Medicare premium is going to go up in 2 years.
And it's adjusted gross income. It's not taxable income. It's adjusted gross income.
Okay, so this is what you're throwing on the tax.
Big number.
It's the big number. So the thing is that when you're doing planning, doing Roth conversion planning, when you're looking at how much to withdraw of IRA versus the bank, and you're saying, well, I want to make about around 200,000 a year. You might say, well, let's make 181,000 a year and take money out of savings out of the rest so you can juggle and basically not pay extra premium on the Medicare.
Right, because that next step up is $238.10. So basically it's $68 a month for earning that extra $1,000.
Right, so things in life that happen. You might sell a second vacation home that's doubled in value, and all of a sudden that shows up as capital gain. That affects your Medicare premium. You might sell stocks with a large gain in your retirement years. Boom, affects your Medicare premium. You need to have planning, tax planning that goes with this. That affects the healthcare. So right now, Medicare premium is means tested. Social Security is not. If I'm thinking about the future, I think Social Security becomes means tested down the road. But that's just me just going crazy. All right, I got to cover another topic here on Post 65. We've all seen different commercials on TV. We've seen Mr. Dynamite talking about the freebies, the freebies about you can get money back from your Medicare and stuff. What are they talking about?
Oh, the freebies. They're talking about Medicare Advantage most of the time.
Yeah.
Medicare Advantage is a different kind of.
What is that?
So. Well, it just went through about Medicare, Part A, Part B, and Part D. Everything's broken up into pieces. Medicare Advantage is Part C. So, yes, I know my alphabet, and I know I skipped C earlier. But Medicare C is Medicare Advantage, which is Medicare that's kind of given through an individual company or a private company.
Yeah, and most or a hospital.
Or a hospital. And so most of the time, it's going to be localized, like an HMO. You're going to be in a network, and that's what you use. And when you do that, the pro side is, yes, it can be less expensive than traditional Medicare for the premium.
For what premium?
For that Medicare Part C or the Medicare Advantage premium, because that's going to.
Is that a gap coverage, basically?
Well, that one's not a gap. It covers Part A, Part B, Part D, and the supplement is all rolled into one thing.
And the cost is a lot lower, but you're limiting who's providing the coverage.
Right. It's lower, but you're limited where you can go. Traditional Medicare, you can go to any provider that accepts Medicare. Medicare Advantage, you have to go in their network, and so you can be limited. And these companies that offer these plans, they come and go. So you get a plan, you really like it, and the next year they say, oh, we stopped offering that plan. Well, then you got to find another one, or you got to go back to traditional Medicare.
And that decision is made every fall.
Yes, that's the open enrollment period.
What kind of months are they? October?
That's October until December 7th.
All right, so Medicare Advantage is an option to try to save money on this healthcare, but you then got to pick about your kind of care, and is the ones provided in your area nearby that you can use, does it work for you? And that's part of your homework every fall in your retirement years when you're shopping Medicare. Not everyone shops it every year because they find something that works for them, but understanding the options out there, extremely important in retirement planning.
And we've had people that took a Medicare Advantage plan. They loved it. They thought, oh, I'm never going to do anything else. And then 2 years in, that company said, well, I'm not going to offer that plan in your area anymore. And so they're forced to do that research again.
All right. If you have Medicare Advantage, we also think you ought to buy travel insurance so that you have other coverage if you do travel outside the area, like an annual policy, not just for per trip type thing.
Right. There are some Medicare Advantage plans that offer that inside the plan, but yeah, you want to know what you've got.
Covered separate. Right. So if you want to save money on one side, make sure you're not blindsided by traveling and having a large exposure on out-of-state coverage or even out-of-the-country coverage. That's a totally another show. Well, there's so much to talk about here, but the idea is this. Planning is not just about save a certain amount of money, hit a certain age. It's putting it all together because what you want is your retirement years to be the best time of your life. That is where you get your time back, where you decide how to use it. Before retirement, the time is tied up with other commitments, mainly your job. A lot of that goes away at retirement. Your time is now consumed by things that you want to do. It's so easy to contact us and to begin winning in retirement. You can simply go to our website at akersfinancialgroup.com. You can head down on that webpage there and look for schedule a meeting. Fill that out. That'll be submitted, and we'll get right back to you. Or you can give us a call and leave us a voice message at 833-WIN-RETIRE. That's 833-WIN-RETIRE. Either way, we'll reach out to you on Monday to schedule a free in-person meeting or a Zoom meeting or a phone meeting, whatever is convenient for you. We need to get to meet each other so we can build a plan and design how you can be winning in retirement. Go to akersfinancialgroup.com or give us a call at 833-946-7384 to start planning for your retirement now. You or Uncle Sam, who will be in charge or actually in control of your taxes in retirement? We'll explain in the second half.
You're listening to a pre-recorded show. Welcome back to Winning in Retirement. Call 833-WIN-RETIRE now to schedule a visit with Brian and his team and begin winning in retirement. Once again, here's Brian Akers.
Thank you for welcoming everybody back, Mr. Announcer. I'm Brian Akers, and I'm also welcoming you back to Winning in Retirement. I'm Brian Akers. I'm president and founder of Akers Financial Group, and this show Akers Financial Group puts on is called Winning in Retirement because we want you to be winning in your retirement. Now, we can't just start at retirement years. We got to start as young as possible to make sure we have that money available so you can win when you want to retire. Today's show, we have Jeff Akers with us. He's a certified financial planner practitioner from Akers Financial Group. What that means is that we are financial advisors here to advise you on your retirement. We're talking on the show generally, but we invite you to give us a call to talk about your actual situation. We call that your personal financial fingerprint, your unique financial fingerprint. When you work with us, it's all about your retirement. It's not about us. It's not about us trying to sell you something. It's about us doing financial planning and guiding you and being an advisor and to be someone that's there to add value for all those years that you have. We are located right here in Maryland, and we work with people all over the world.
Okay, Brian, right before the break, you said you or Uncle Sam, who will control your taxes in retirement. What are you talking about?
Well, Uncle Sam, I don't have an Uncle Sam, but that's a term for the federal government. Jeff likes to use Uncle Sam and other terms, but so generally it's like this. If you think about retirement and if you think, oh man, I'm going to pay a lot of taxes in retirement, my brain thinks, well, who decided that you're going to pay taxes in retirement? Well, do you guys know that when you're saving your money, you're making the decision now on are you going to pay tax in retirement or not? So what we're going to try to talk about here is this. The two biggest expenses in your retirement years are healthcare and taxes. If we can reduce the taxes, we can afford the health care, hopefully. But the taxes, let's pay as little as possible. Let's try to figure retirement out where we're not sending everything away and where there's no money left over for us to play and enjoy what we work so hard for. So think about it this way. Let's say you're 35 years old. You're trying to decide pre-tax or Roth, and you're thinking, well, can I afford the extra couple of bucks on taxes now? The answer is this. When you retire, do you want less taxes? And we want the answer to be yes. Let's pay a little tax as possible in retirement years. Let's not get hammered. We've seen a lot of great savers, a lot of people who've invested very well, just get hammered when they're 72 years old because their pre-tax money is fully taxable. And that's a tough place to be. So we're going to try to break this down and explain it to you. Does that sound all right, Jeff? Okay,
that sounds good. That's that 35-year-old, yeah, I like the Roth IRA for him because all that growth, tax-free, never gets taxed. Oh, I love Roth. All
right. So the first thing is this, is that in the early 80s, ERISA changed and came out with the idea of a 401k where you pre-tax your savings. Basically what they did is they went from pensions and then put retirement savings more on the employee. And so they offer some matching at some companies, which is a little bit of money, which gives you some incentive, but it's a lot cheaper on companies than what pensions are or what they used to be. So what happened was pre-taxed now, and then the money would grow, and as it grew and grew and grew, it came out taxable later. The concept was that you make more money during your working years, and you'll be at a lower bracket in retirement. Our concept is, do you really want to be at a lower bracket in retirement where you are making a lot less money? And I don't think you really want to be that way.
Yeah, there's only one way to be in a lower bracket, and that's to earn less money.
And have less money to live off of means you can't do the things you did while you're working. So is that the retirement you want?
We don't want you to have to reduce your standard of living in retirement. We want you to enjoy retirement, not suffer through it.
So we have to have a balance. The balance is this. If we can pay some tax now and prepay it and then let that money grow without tax to be tax-free, what that does is this. We pay tax now and never again. That's a Roth IRA. That's inside your Roth 401k, your Roth TSP. That's an option. If you put $100 up pay out of there, you're going to have more than $100 out of your pay, out of your net bring home because you're paying tax. But once you get used to that and get that rolling, you can then bump it up more. But the reality is when we get to retirement, you're going to have a bucket of money that's not going to be taxed, and that's going to be a helpful thing when we're looking at your retirement years.
Right. When I talk to people about contributing to a Roth IRA, Roth 401k, anything like that, I say, you pay tax on what you put in, and any investment that we do for an IRA, we want it to grow over time. So there's going to be growth in that Roth IRA, and depending on when you start, if you start early enough, it can be a lot of growth in there. And when you get to retirement, all of that growth comes out tax-free. And so that means that growth was never, ever taxed. And that's just a thing of beauty.
Yeah, so there's different arguments. Like Jeff and I argue with CPAs. And the topic is typically taxation this year because we know the tax. We want to pay the least amount of tax right now. And then we're thinking 20, 30 years down the road thinking, well, when someone walks in retirement, we want multiple choices of money to draw on in retirement. We do not want to have everything in a pre-tax 401k. Because when we have clients like that, what has been your experience, Jeff?
Oh, they get to retirement age. And one of the things that I've heard that just surprised me, I guess, is, in retirement, I don't pay any taxes, right? And I look at what they've got in their 401k, and it's like all of that is taxable. You're going to pay tax on all of it. And even if you don't need it right now, when you get to 72, the IRS says you're going to pay tax on that money. And so just getting through that, yes, that money is taxable, and they'll have a big chunk of money. And if they're good savers, like Brian talked about before, when they get to age 72, they have to take more out than they actually need. And they're really frustrated that they have to pay tax on what they're forced to take out.
But if that's your only source of retirement, basically it works like this. You need to buy a car, and then you look at your investments, and let's say it's $1.5 million, all in IRA, and a little bit in savings. You don't have any other money for that car, for that vacation, for that big expense. Your only choice is to take out more money out of a retirement account. That means if you need $30,000, $40,000 for a car, you actually got to take out more than that to cover the taxes. What we want in retirement is multiple accounts. We want to have a personal account, individual or joint, where you pay taxes a little bit every year. You get capital gains, which are less taxed, qualified dividends, which are less taxed. It's a good way to have some of your money. You also want tax-free, and you want pre-tax. Now, the thing about retirement, imagine that you have a 401k offering at your company and they match. The 401k Roth is what you put in as the employee is tax-free. The match is not. The match, anything discretionary from the company, is going to grow pre-taxed, and then that will be taxable in your retirement years. It cannot be Rothified. It's going to be taxed when you retire.
There's a way to Rothify it, but you have to convert it, and when you convert it, you pay the tax on it. So there's a way.
Why did you have to go into such a hard topic on top of that? I was all excited about my Rothify word. I thought we'd stick with that for a while.
I used Rothify.
The Roth means you pay tax once and never again. So the idea is, when do you want to pay it? Now, I found if we pay tax on smaller amounts, it makes me feel good.
Yes.
And then it grows, and then I pay no tax on larger amounts. I like that. That's why a Roth is something you really need to consider. So when we're looking at taxes, and let's say you're real close to retirement and you didn't do it, we have our taxes and our issues with taxes, and part of it is understanding taxes themselves. We want to try to explain tax brackets and the game of understanding tax brackets in and through your retirement years. What's a tax bracket, Jeff?
Boy, tax brackets are one of those things that's misunderstood as well. You've probably heard that there's a 10% bracket, 12%, 22, 24, then 32, 35, 37. So these are tax brackets based on your income. The more income you have, the higher bracket you will be in. One of the misconceptions that we have, though, is that, well, you're in the 32% tax bracket, so all of your money is taxed at 32%. Well, that's not true. Some of it's taxed at 10%, some's at 12, some's at 22, and so forth. So it kind of stair steps its way up, but the tax bracket is the highest number that you attain with your taxable income.
Yeah, so think about it like steps, where the first step is a 10% bracket on the federal. And the next step, when your income gets to that next level, you jump up to a 12% bracket. But then the next step is a big step. It goes from 12 to 22. There's a 10% hike. So that's one planning piece right there, is where if we can stay below the 22 and pay everything we can at 12%, that's a great place to be. Now 22 becomes 24, and then the next large step is 24 to 32. So understanding those two large steps in the tax brackets can be a big deal. Now you can also think about it as a NCAA bracket for the basketball tournament. You know how it shrinks down over the years? Well,
to the Final Four?
To the Final Four. Well, if you're in the top 4%, you're paying a lot of taxes. So as you raise your income higher and higher, and the amount of people that are at the higher brackets, you're paying a lot more in tax. The other thing to think about when you think about 4 is there's 4 years left with these current brackets under the law the way it is now. Taxes right now are pretty good compared to where they're going to be in 4 years. And in 2026, these tax brackets from 12 is going to become 15. They're all going to bump back up to the 2017 rates. They're going to sunset in 4 years. Tax brackets and planning through tax brackets is another key piece of planning in retirement.
And that's a reason that we like to pay tax now and never again.
Absolutely. Planning early and often gets us a lot of choices in our retirement years. We do have a lot of clients that call us at 55, 60, 65, and they all want to start planning. And we got to work with what we have, with what's there. The younger people start, we enjoy the concept of helping them get to where they need to be and building this combination of a retirement plan that gives us lots of choices at retirement.
Yes. In fact, there's some folks that they worked a job, they had a little 401k, roll it over to an IRA, and then they decide they're going to go back to school. So now they've got no income. What a great time to convert to a Roth IRA.
Lifetimes give us opportunities. Those chances of opportunities where we have low income years, Roth conversions are a great thing to do. What we want is this. We want you in your retirement years to basically have no worries about your day. We want you to only have one main worry or one main concern, and that's where you're going to drink your morning cup of coffee, where every day seems like a Saturday free of stress. Your retirement income investments are taken care of by the team of advisors at Akers Financial Group. This is the future you want. It's not too late. Go ahead and give us a call, or you can go to our website at akersfinancialgroup.com. If you go to the website, go ahead and scroll down and schedule a meeting section and fill that out, and we'll contact you on Monday. Now, you have a choice here. You can come either way. You can go through the website, or you can talk to us through our phone number. And the phone number is this. It's 833-WIN-RETIRE. That's 833-WIN-RETIRE. You give us a call, and then what will happen is this. On Monday, we'll call you back and set up an in-person meeting, a Zoom, or a phone meeting. So go to akersfinancialgroup.com or visit us. By visiting us on our website, you can check us out, read more about our information, and fill out that schedule a meeting section, or give us a call at 833-946-7384 and start planning for your retirement now. Your long-term medical care is a family decision. We'll explain in the final quarter.
You're listening to a pre-recorded show. Welcome back to Winning in Retirement. Call 833-WIN-RETIRE now to schedule a visit with Brian and his team and begin winning in retirement. Once again, here's Brian Akers.
Welcome back to Winning in Retirement. I'm Brian Akers. Here with me today is Jeff Akers. We are certified financial planners from Akers Financial Group, located right here in Maryland, but we work with clients all around the country. Now, as CFPs, we're financial advisors here to advise you. We look forward to a personal individual advice. The radio show is all basic information. Now, today's topic, two biggest expenses in retirement, is not basic information. What you'll find is that it leads to more and more questions. And that's why we invite you to check us out on our website, AkersFinancialGroup.com, or give us a call to set up that free initial meeting to cover questions you have and see if we're a good fit when it comes to working with you as your financial advisor. Now, our website, AkersFinancialGroup.com, you got to go there. And when you check it out, check out our radio tab. You can listen to past shows. You can listen to them pretty much anywhere. You can also listen to them while you're driving, or you can listen to them while you're sleeping. It's good, easy listening music, right? You can also check out a tab called Webinars. It's different videos that we've put together on some topics over the last year and a half. Most recently, put a market review and outlook on this site there. But check out Akers Financial Group. Check out our team of people, our team of CFBs we have at Akers Financial Group. We look forward to meeting you after you check this out. All right, if you have not been listening since 11 a.m., you've missed a great show. The show so far is called The Two Biggest Expenses in Retirement. We talked about pre-65 healthcare, post-65 healthcare, and then the third quarter we were talking about taxes. And now we're going to talk a little bit more about taxes and talk about long-term care. We got so much to cover. I thought we'd cover this first question is this, Jeff. Your long-term medical care is a family decision. Now, at Akers Financial Group, what do we mean by this?
So when the time comes for long-term care, that usually means that the person can't take care of themselves. And sometimes the person doesn't recognize that they can't take care of themselves. So the family has to step in and, help them through that time. So it's a family issue, and so it needs to be a family decision. If, as you're planning for retirement and you're planning down the road, you need to have a conversation with your kids or whoever it's going to be and say, all right, you're the one I'm going to move in with, so get ready. Or you need to have something lined up. Just have a family meeting and talk about, here's what I want to have happen when I reach a point where I can't take care of myself.
Yeah, because what happens as a financial planner is that we want you to be winning in retirement and enjoying all that time, but we have to plan for the good days and the bad days. The good days are typically a lot of things are going on. Then there's sort of a bit of a slowing down period. And then sometimes towards the end of life, there's some really tough days on the medical side. And that's where you have a need for long-term care. Now, I wanted to start, Jeff, with a tough question, which I did not warn you about. All right, so...
But my background is marriage and family counseling, so, yeah.
It has nothing to do with that. It has to do with someone's in a hospital, and they're coming out of the hospital, and they have to go to rehab and to a long-term care facility. Does health insurance cover that?
So Medicare will cover rehab for a period of time, but it's not indefinite, and you have to be improving while it covers that. But once that time is up, then there's no health insurance. Medicare doesn't cover it. Medigap policies don't cover it. Medicare Advantage doesn't cover it. Regular health insurance doesn't cover it.
And it meaning the long-term care part.
The long-term care part. And that's where you're no longer getting better. It's no longer rehabilitation. It's just maintenance care.
So maintenance care is not covered, but if a nurse is there providing certain medical care, it's still covered, right?
The certain medical care is covered. If you need medications and things like that, that part is covered. But when we get into needing help, you can't take care of yourself, we're talking about activities of daily living kinds of things. So that's where you can't dress yourself, you can't feed yourself, those types of things. The person who provides that care, it's not health care. That's maintenance care. And so that's not going to be covered by any health insurance program.
And so what happens is if you do not have this conversation with your family, their decisions are going to be made for you at a very stressful event in life. And so we'll get a call from a client and they'll say, mom's in the hospital, what do we do? And then we're like, oh, so she never did talk to you about this, did she? Now, these are options. We start talking and going through that process with them. Now, that process begins with information about what's going on in their health care to start.
Right. We need to know what's going on. If they're in the hospital and going to rehab, they're going to go to rehab first. And so while they're there, we need to know, are they going to get well enough that they can leave and come home, or are they not? And we need to take the next step in planning for how we're going to pay for what happens next, that next step.
Right. So in Maryland, there are different levels of care, like assisted living and nursing home. I know all of us think, I'm going to come home, be taken care at home. And what's the number one reason people cannot come home to be taken care of, Jeff?
Well, that's an expensive way to be taken care of.
It's the most expensive, right?
Right.
Because if you paid someone by the hour to take care of you at home, that's not family. It can be extremely expensive each day. And that's why people do go to facilities for assisted living or long-term care.
Right. And the facility provides things like, of course, the shelter, but food and that kind of care. And that's just where it's the least expensive way to provide that care.
And the cost on assisted living nowadays, what have you seen? I saw $6,800 on an assisted living just recently per month.
Right, just per month. Yeah, on average in Maryland, it's over $100,000 a year for a semi-private nursing home room. Semi-private means you have a curtain between you and your roommate.
All right, so the more private, the more choices you want means more money. Now, in trying to solve this solution, there's different options. One is moving in with a family member who might be that perfect daughter, nurse, the son-in-law, someone who can have free time to take care of you.
It's not likely to be the son-in-law, but it might be the perfect daughter or daughter-in-law.
All right, but how about the other choices? There's the concept of you have enough money and you can afford to cover it.
Right, you can pay for it yourself. Some people, they plan kind of way ahead and they'll move into a community that's called a progressive care community. So at first you move in, you're on your own, you can do everything and you're fine. And then you need a little bit of help and they provide it. You need a little bit more and you can progress through the care in that particular facility. So that's one option. Staying at home or moving in with a family member is another option. And sometimes you just have to go to a facility at that time. So one way to pay for it is self-insured. And self-insured is you're just paying everything out of pocket, your regular expenses.
And then they use your money. They use the money that you have. They send you a bill every month. You just write checks and pay it as long as you can.
Yep, as long as you can.
And so we call that self-insurance, where you do it yourself. Some people actually there's two other options to cover. One is they go out and they buy insurance that cover a long-term care piece so that they're not using their investments or their net worth or their real estate instead. Right.
They're providing that benefit or whatever through an insurance company. And insurance, there's a couple of kinds. There's traditional long-term care that just pays that. And then there's a life insurance kind where you've got life insurance and you can use the death benefit for long-term care. So there are ways to have insurance cover some of that cost.
Right. So that's something that we do at Akers Financial Group. We are insurance brokers. We shop that around, try to design a plan if it's a good fit for the client and based on what they want to do. If you have something that you need to protect, that's when you buy the insurance because that's what it would be there for. The other thing is if you have not saved well at all, there is Medicaid planning. What's a simple review of what that might be?
Yeah. So for folks that self-insure but they don't have a lot of money, they're going to run out of money. And you apply for Medicaid at that time. And Medicaid has a lot of rules, a lot of hoops to jump through. You're going to want to get help in order to get that because the person who's in the facility can't have more than like $2,500 in their bank account. They can't have investments. And there's certain rules for married couples, how much each one can have. And so there's just a lot of hoops to jump through. And you want to make sure all the I's are dotted and all the T's are crossed because when you apply for Medicaid, they're going to ask for statements for all of your financial accounts for the last 5 years. Yeah. And they're going to go through them and say, where'd this money go?
All right. So when you're thinking about long-term care or long-term medical care for yourself, that's something to think about as you're retiring. The reason is typically you're healthy as you retire. And what you can do at that time, you can examine, do you need the insurance or not? Do you need to buy it? The earlier you buy it, the better because it lowers that price. You don't want to wait too late because then it's near impossible to get. The other thing that you need to do in retirement is just figure out what you're going to do. Maybe you have earmarked some money to cover it. That money set aside cannot be used in your retirement planning because it's there for the healthcare part. So making it part of your retirement planning is extremely important. That's one of the main information pieces that we want to try to cover today. So today's talk is called Two Biggest Expenses in Retirement, Healthcare and Taxes. Our topics today should be an hour-long show per topic. This was like a 3-hour topic, all squeezed into our show today. We've been hitting the topics just like a flyby, just telling you some things that we see. We want you to think about this. Are you ready for these two biggest expenses? Many times people focus on their investments only. They don't think about, where's the money going? What is it needed? What is my purpose of all my money?
Mm-hmm. Yeah, one of the things that, like I said earlier, these are two topics that people ignore or don't think about and when they're planning for how much they're going to need in retirement. And one just quick thing that people don't necessarily realize, when you're working and you've got health insurance and you're paying for some of that health insurance through work, it's tax deductible. It comes out of your check pre-tax. When you're in retirement, you're paying for Medicare or you're paying for a supplement or Part D, that's not tax deductible. That does not come off of your income. So there's like that added expense almost when you're in retirement. It costs a little more.
Yeah, I mean, if you have a major expenses and you can qualify for itemization, but that's a very high number that you'd have to build up with a lot of expenses in 1 year to hit an itemized deduction for it,
Yeah, depending on the year, either 7 or 10% to hit it.
Yeah. So two biggest expenses: retirement, healthcare, and taxes. We try to cover it. Hopefully you got it covered for your retirement so you know things are going to be just right. That's extremely important to know where your money's got to go when you're retired.
But if you don't, give us a call. And if you think you might not, give us a call.
When you think about cash flow and debt and all these other decisions you're trying to make, we love for people to be out of debt before retirement so they can use that portion of their budget for these expenses that they need to make sure they cover properly throughout all those years. All right, thanks for a good show, Jeff.
Loads of fun.
Loads of fun. I just don't believe it. All right, we want to thank you for listening to the show, and we want you to win in your retirement by taking advantage of an opportunity to begin planning with us at Akers Financial Group. To schedule your free meeting, simply do one of the two things. You can just go to our website at akersfinancialgroup.com. You scroll to the schedule a meeting section, go ahead and fill that out, and that'll be submitted to us, and we'll be contacting you. Or you can give us a call and leave a voice message at 833-WIN-RETIRE. That's 833-WIN-RETIRE. Either way, we'll reach out to you on Monday to schedule a free in-person meeting, Zoom, or phone meeting. Start planning for your retirement now. Go to akersfinancialgroup.com or call 833-946-7384. Thank you for listening. I'm Brian Akers from Akers Financial Group, and we want you to be winning in retirement.
You've been listening to Winning in Retirement with your host, Brian Akers of Akers Financial Group. Brian Akers of Akers Financial Group is a registered representative offering securities through Kalos Capital Incorporated and investment advisory services through Kalos Management Incorporated. Akers Financial Group is not an affiliate or subsidiary of Kalos Capital or Kalos Management and does not provide tax and legal services. Advice given on Winning in Retirement is general in nature, and one should seek further advice from their financial advisor, broker, attorney, or tax accountant before investing. Be sure to read each prospectus carefully to understand all the risks associated with each investment.